development in medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have an excellent show for you this evening, and I'm just so happy to bring it to you because it's a chance for me to allow you to understand, well, just one more component of being healthy, understanding how to do better as far as all of us taking care of ourselves. And we're going to talk today about back pain, which is very, very common. Believe me, back pain and we have an intimate relationship. So believe me, I'm going to listen closely today. All right. Well, let me talk about sharing and caring. Remember, take care. Don't ignore your med moments. Go see your doctor. Remember, it's so important for you to take care of even the little things, because the little things become larger things as time go on from a medical standpoint if you don't take care of them. You know, there's a commercial that I remember, and the guy is standing there and he says, either you're going to see me now or you're going to see me later. Don't let that be you. When med moments occur, go see your doctor. Obey your doctor. That's another thing I want to talk about. We have a new website, and it's called Obey Your Doctor. ObeyYourDoctor.com. Come, email me, let me know what's happening. From the website, you can email, and you can hook me up on Facebook, and all that good stuff is out there. So Facebook, Obey Your Doctor, or the website, ObeyYourDoctor.com. All righty, let's talk. Let's talk about something that's very important. This is very important as well because it's called high blood pressure. And I just want to say a few things about high blood pressure before we get to the main topic. Well, 1 in 4 Americans have high blood pressure. That's a lot of people because there are a lot of people in this country. So you understand how the numbers of people that have high blood pressure, and it's enormous, and we need to take care of it. What causes high blood pressure? Well, there are many things that can cause high blood pressure. Obesity can cause it. Smoking or overdoing alcohol can cause high blood pressure. Lack of physical activity. Salt, increase on, now you know we all love salt on our food and we increase the salt. And be careful with your salt. It really does increase your blood pressure. Stress, now stress will do a lot of things to you, but high blood pressure is one of them as well. Stress will increase your blood pressure. Old age. As we get older, our blood pressure goes up, believe it or not. And family history. If mom and dad had high blood pressure, there's a good chance that you may have high blood pressure as well sometime during your lifetime. Symptoms of high blood pressure or hypertension. Difficulty breathing. That can occur. Believe me, you can have heart problems, you can have lung problems, that you can have shortness of breath secondary to your blood pressure being so high. Irregular heartbeats. Remember, high blood pressure over time does affect the heart. Blood in the urine can occur as well. Severe headaches. Oh, definitely. Your blood pressure is very high, you're going to get a headache. Fatigue and confusion can come about as well. Vision problems, blurred vision can happen, and chest pain can also occur with high blood pressure. Well, let me tell you what the values of blood pressure should be. 120/80, it is perfecto. Anything in that range is good. If you're above 140/90, then that is high blood pressure. So you would definitely want your blood pressure to be below 140/90, and if it's in the range of 120/80, you're perfect. All right. Thank you for your patience and allowing me to say that. Now, we're going to get to the meat of the subject today. And the basic topic is back pain. And I have the perfect person to talk about back pain. He's been here before. He's excellent orthopedic surgeon. I'm talking about Dr. James Lee Jr., and we're going to talk about back pain. Dr. Lee, welcome to our show.
So glad to be here.
All righty, all right. So this is a topic, and as I stated, I've had back spasms, and I wasn't doing very much. You know, I was outside, I was washing my car, I bent down, and there it is. And next morning, I couldn't get out of bed. So we got to talk about back pain. Tell me, what is back pain and why do we get it? What's happening there?
It's a very, very common complaint. So back pain is a result of multiple things.
Right.
A muscle strain, an injury to a bone, and typical activity like you described can cause an overuse type of injury.
Right.
The muscles in the back are very large, and they can be subject to a lot of force. So if you bend down a certain way and you're not balanced, you can certainly injure a muscle.
Right.
And because it's so large, it can go along your entire back, and it's very painful. That spasm you mentioned of back pain that we talk about is when the muscle contracts and it's been overused and it's responding to a stress that it's not used to.
Right, right. I understand and did a little, I'll be fair with you, I did a little reading before we came because I tried to be up on this,
Sure.
that it's very common and it's one of the most common reasons for people to actually go to the doctor is pain in the back. Why is it so common? I mean, is it something that that we ignore and we're just out of shape, or are there other reasons that we would have back pain for that, going to the doctor?
I think that's an excellent question. If you look at a typical community practice, you have blue-collar workers, heavy-duty laborers, you have people who are obese, you have people who are out of shape. Very commonly, there's imbalance between the low back muscles and the abdominal muscles. When we bend forward, when we lift, when we carry, all of these muscles have to work together. And if we're out of shape, if our posture isn't good, then these muscles don't work together and one side gets strained. And typically it's the low back that sees it, because we most of the time will bend forward to do something.
Right.
If you are in a car accident or your job requires you to do repetitive heavy lifting, you're also at risk.
Right.
And I think it's very important that somebody who has an occupation that requires them to lift, that they lift properly, that they use their leg muscles, they have balanced abdominal muscles and low back muscles so that they decrease their risks. Also, if you look at folks with very large bellies or who are obese, they naturally aren't balanced. And if they do something that's strenuous, they're really going to put a lot of force across their back and subject themselves to a lot of pain.
Okay. Now, when you're talking about pain, most of the time it's the muscles that are spasming, or are there times when the spine may be associated with this?
Excellent question. Typically, if there is a higher type of energy injury or force, you might deal with a fracture or injury to a nerve.
Okay.
Most of the time, if it's routine activity, bending forward, lifting, it's going to be the muscles because the muscles see the force. However, when we bend forward, the nerves in our back, as well as the disc, we call it, are subject to force. If you look at this model here, this is the spine. So it's made of bone, what we call a disc, which is a cushion, and then there's nerve behind. So as we bend forward, the disc can sometimes push back, irritate a nerve, and that causes that pain that goes down the leg. Some people refer to that as sciatica. So the spine is made up of all these: bone, soft tissue, muscle that surrounds it, and then the nerves that are behind it that are sometimes subject to being pinched or irritated.
Right.
And that increased energy or force is what eventually is going to cause this spine to potentially be injured and cause a structural problem beyond a muscular injury.
Okay, okay. Now, in looking at that, and what we're going to do is, when you hold it, let's hold it towards the camera like that. I'm going to let you hold it, but you know what I mean? I want everybody to see this because it's so important. Now, understanding that the nerves actually come out of the spine.
That's right.
So, for instance, if someone has arthritis,
yes,
and over time, and an elderly person, then I know all bones to a certain degree, osteoporosis and stuff like that, the spine kind of changes and the disc may change. So that actually presses on the nerve, and then you get symptoms from that.
Absolutely. So if you look here, there's not a lot of room for these nerves. It's a very narrow space.
Right.
So as you describe aging and arthritis, the surrounding bone or architecture of the spine changes. And we call that bone spurs or arthritis. So you get basically bony overgrowth around the nerve.
Right.
The nerve then has less room, and as it becomes compressed or pinched, it creates these symptoms of pain that shoots down the leg, burning, a stabbing pain, weakness in the leg, inability to raise your foot off the ground. Those are all part of this process.
Okay, all righty. Now, that's what you're talking about there with the pain going down the leg and around the buttock region and the hip region. That's sciatica?
Yes, that's correct.
Okay, because we throw that word around a lot. I hear that word a lot, but I want to have an understanding of what we're talking about.
Sure. So sciatica means a sciatic nerve. So the sciatic nerve is the big nerve that goes around our buttock, goes all the way, it branches out and goes to the tip of our toe, and it controls the motion in our foot. That nerve actually originates from the spine.
Right.
And it's the largest nerve in the body. So that's where it begins. It's almost like at the top of a river, and the sciatic nerve is in the middle, and it goes all the way down till it empties in the ocean. So the sciatic nerve, wherever it's pinched, whether it be by the buttock or by the spine area, will cause this burning pain or sensation that goes down the leg.
Okay. Describe the spine for me. The spine it starts at the back of our neck and it comes all the way down to the bottom of our, the coccyx bone or something like that.
Yes, that's right, that's right.
Describe it, describe the spine. How is it broken up into sections and stuff like that?
Great question. So to support our head and skull, we have the cervical vertebra. So they're specialized. They're like this.
Vertebra.
Yeah. So look at the bones in our, we're building blocks. We call them vertebra. But that is the doctor term. But it's basically the bones. And in our cervical spine, there's 7.
Okay.
It goes down to the thoracic or area by our chest, and there's 12.
Okay.
And as we go below to our low back, there's 5. And then we have our sacrum and then tailbone, as you described. Each of them are different. Our spine, if you will, is more like an S shape. So it supports our head, goes, there's a small curve as it goes down our chest, and then curves again so that when we're upright, our head and neck is supported and our torso is supported. If it were straight, if we bent forward, we'd topple over. So it's in a way that it supports our head and our lower body as well.
Okay, all right then. Now I know that, and just for instance, my dad, he would walk, and my wife states that I'm this way. I tend to bend over, and I have to consciously stand up and correct myself because I don't know if it's habit or there are certain things that may be hereditary with the spine that you may feel more comfortable in this position than this position. How does that play?
So what you're describing is what we would call alignment. So the spine naturally has a certain alignment that allows upright posture. That alignment can be affected by a number of things. We describe muscle spasm. So if you go into a spasm, many people will bend forward because that's a position of comfort. It feels a little bit better to do that. Or sometimes the muscles won't allow you to straighten up because they're very tight. That's one cause of, we call it malalignment or change. Another, if you look at an elderly person, these bones can shrink. So they no longer support your neck and head in a certain way. So then your center of gravity or what holds your head upright changes. So then your center of gravity changes and you see folks walking forward. Other people, it's a muscle imbalance where their posture isn't 100% correct, or they're out of shape and they're not able to keep themselves upright. So there's multiple causes for malalignment, and those are some of them.
Okay. And what would we do about malalignment? Would it be exercise? Would it be swimming? Would it be, going to the gym or stretching? How do you correct that the best you can?
Yeah, so that's a wonderful question. I would say training the muscles, upright posture. Some folks need reminding to sit upright. Balance between the core muscles, the muscles in your belly, the abdomen, as well as your low back muscles, making sure that there's symmetry between the two. If one is stronger than the other, there's a tendency to either lean forward or lean back. Ultimately, it's about taking care of your body and staying in shape.
When we do get muscle spasms, and I'm sure most of us who are adults have had some varying range of muscle spasms in the past, how long do we expect it to last if we're doing whatever we need to do? And I'll ask you what the therapy is later. But how long should it last? Should it go away in a couple weeks or a couple days or last for 6 months? How long should it last for?
Well, typically a spasm is sort of an acute, quick reaction that a muscle has. Most of the time, with a combination of rest, medication to help the inflammation. Sometimes
inflammation is swelling around.
Swelling,
it.
exactly, swelling. A muscle relaxant to help that muscle relax.
Right.
And time, you're looking at probably a few days.
Okay.
If it lasts beyond a few days, then I think it warrants a visit to the physician for sure, so that we can look into the cause. Is it something more than a routine muscle strain that's involved?
Okay. Now, should we be on our way to an orthopedist, or should we stop by the primary care and say, give me a referral to the, no, you understand what who should we go to first?
Okay.
I mean, when should we really be concerned, and where should we go?
Wonderful question. I think for the routine low back pain, visiting the primary care doctor is fine. Okay. They can, primary care physician is fully adept at screening for any kind of major issues in the spine. When you need to see a spine specialist is when there is weakness in your legs, inability to go to the bathroom, balance problems, difficulty buttoning your shirt. Those are all red flags that there's something probably a little more serious than routine back pain. If you look at the model again, if a nerve is being pinched, or worse yet, if the spinal cord is being pinched by a nerve or some type of process, it will let you know right away by dysfunction. You're not able to walk, your bowel and bladder function changes. Those are really red flags that really need to be addressed urgently.
Are there some risk factors out there that just, as you say, red flag, that's just very obvious that's a risk factor, that you're going to have back spasms or you're going to have spine problems or something? What are those risk factors that you would think of that we should know about?
Definitely obesity is one.
Right.
Believe it or not, smoking is one as well. Smoking is associated with back pain. Yes. Occupation, overuse injuries, heavy-duty injuries are some of the things that put you at risk. Yeah.
Okay, all righty. Are there specific things that you tell your patients to help prevent these symptoms from coming on, or these spasms? I mean, if you do this and this and this, there's a good chance that you're going to have, strong back and, that type of. What are some of the things that you would tell your patients?
So some of the simple things are tasks around the home, like lifting.
Okay.
So I think many of us tend to just lean forward and pick something up off the ground.
Yeah, don't we?
Yeah. Right away, that actually increases pressure. If you bend this, you can see that. If you bend, it's going to put pressure back here. Okay? But if you're able to use your muscles in your legs, in your trunk, in your abdomen as you pick something up, then you have balance. Then you take some of the force across the back. So simple tasks like lifting, use your leg muscles. Use those muscles to help balance you and decrease your chances of having something go on.
Okay. We're going to take it a little further right now. I know that, and you stated that the primary care doc could handle the simple things. But there's always, if that initial treatment does not, take care of the problem, then what are some of the other things that we should think about? I know that some things I think about are like fractures or something. I know that there can be other things. Tell me about the secondary things that a doctor would think about as far as working up for back pain.
Sure. So back pain that stays around for a while, associated with night pain, weight loss, fevers, or chills. Now we're starting to think about things such as tumors. Where basically the nerves around the spine are being affected, or the bone itself can have a tumor or a cancer inside of it causing this problem. There can unfortunately be what we call metastasis. So if somebody has like a lung cancer, a breast cancer, it can travel, and unfortunately the spine is one of the most common areas that's affected. The most common cancers to reach bone be prostate.
For men.
Yes, prostate for men.
All right, so that's
breast for women.
Oh.
Okay. Kidney and thyroid. Okay.
Oh.
Yeah, these are some of the ones that if a patient has these problems and they say, listen, my back is just not right. I'm feeling pain at night, a weird feeling down my leg, maybe losing a little bit of weight. Then we're looking at a workup like X-rays and maybe MRI to really look to see what is going on.
Okay. Now, when you talk about fractures, usually is it associated with someone falling or you know what I mean? Is that you, or can you have fractures secondary to maybe the cancer coming in and causing destruction of the bone in the area?
Excellent question. I think it's a spectrum, meaning there can be high energy car accident, wrecks that cause just an absolute trauma that breaks the bone and causes a problem. And then, as you stated, with the cancer and infection, it weakens the bone. It weakens it. So then, maybe a routine daily part of life, like a sneeze, or somebody just stumbles, then that'll cause a fracture because the bone is weak. Yeah, exactly.
Now, two things that you said were very, very important. I just want to go back to them just for a minute because I think it is just so crucial. You said prostate disease or prostate cancer for men.
Yes.
And that's something that I think each and every man should, you should have your prostate examined and you should do the test at the doctor, the blood tests and things like that to make sure that you're on top of your prostate health. And for females, breast cancer.
Yes.
And it seems like two very common cancers are the ones that gravitate to the bone.
That's right.
And you mentioned a word called metastasis.
Yes.
And that actually is that cancer cell actually getting into the bloodstream.
That's right.
And going from the initial cancer, which may be breast or prostate, and traveling through the blood to the spine.
That's correct.
And then starting up there.
That's right.
Okay. All right then. I just wanted to get that. When you see your patients in the office, is a good history important?
Absolutely. Absolutely.
All right.
Yeah, I can't emphasize that enough. We want to know the cause.
Right.
Is it something that we just talked about? Is it related to a health problem? Is it an occupational problem? Is it from work? Is there stress involved? I think it's so important because it can focus the exam and allow us to really pick and choose the appropriate tests so that we're able to get to the bottom of the problem.
Okay. When patients have back pain, is there a certain part of the back that is affected more so than another part?
Yeah, great question. Most commonly, I see low back pain.
Okay.
That's towards the bottom. That sees a lot of force. As we bend forward, that sees the brunt. And so, day-to-day task, we bend forward commonly, we lift overhead, but most commonly it's in the low back.
Arthritis. When arthritis affects the spine, is it more common in the neck? I know a lot of times patients say, oh man, I got a stiff neck, I can't bend my neck. Is that very common, or is it usually, or can it be anywhere in the spine?
It's because the neck and low back actually move more, so bending forward with our neck, bending forward, with our low back, those two areas are the most common.
Okay.
If you were to x-ray most individuals in their 60s, you will see arthritis.
Okay, all right then. Compression fracture. All right, I hear that word, I hear that thrown around a lot. And you just have a compression fracture. And I'm like, tell me, first explain it,
Sure.
what it is, and why we would get it.
Sure.
Some of the reasons why we would get it. So because we will hear that as patients, and so that we can understand.
Absolutely. So if you look at the side profile view of the bone, we call this the vertebra, but this is the backbone. It has a certain height.
Okay.
If, for whatever reason, osteoporosis.
Osteoporosis is when the minerals...
The content of the bone is more like a sponge rather than being thick.
Right.
And it's not as strong anymore.
Okay.
And so that calcium content goes down. The architecture of the bone is more like a sponge, and you lose height.
Right.
And so instead of it being this height, it compresses down. Okay. And then it can affect us in our low back, and also oftentimes we might see the little old lady who kind of walks forward like this. Oftentimes in their neck, they have small compression fractures, and their center of gravity changes, and they have to lean forward because the spine no longer supports them in the same way.
Okay, all All right. I want to, we're sort of running out of time, and there's so much I wanted to cover.
Sure.
As far as diagnosing, because when the patient comes to you and this back pain is not going away, what do you do for your patient to try to figure out exactly what's wrong? Is it the spine? Is it muscles? Is it the cartilage? Is it osteoporosis? How do you figure it out?
Okay, so we get a good history, like you mentioned. We do a very good neuro exam. We test the nerves that control the fingers, the feet, and the lower extremities, our legs. And by doing so, we can oftentimes find the location of where the back pain is coming from.
Right.
And then from there, we can order an x-ray, look at the bone quality, and if we're concerned about a change or a pinched nerve, then next would be an MRI, which would be a special type of x-ray that shows us nerves, muscle, and tissue in the back.
Okay. And when we start talking about treatment, what is the more common treatment that we find that we give patients with back pain?
Sure. Routine low back pain responds well to physical therapy, exercises, helping those muscles relax, basic anti-inflammatory medications like Motrin, Advil, Tylenol. Activity modification, meaning if you're bending up and picking up 75 pounds and you're doing it the wrong way, then we have to maybe change that behavior. And unfortunately for many of us, it's a little bit of patience, giving it a little time to respond to the treatment.
Okay, all right. You know, this has been excellent, and the time went too fast, I'm telling you. Dr. Lee, thank you very much for coming.
So glad to be here.
All righty, all righty. Well, in closing, what I'd like to say is, remember, knowledge is key, but action is power. Obey your doctor. Always obey your doctor. And think of our website, obeyyourdoctor.com. Come and visit us on the website. There is so many medical educational tools on there. I just want you to come and check it out so that all of us can be better healthcare consumers. Never institute any change in your medical therapy before you see your doctor. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.